I have not had any issues with work ethic with my colleagues. I really haven't. I feel like people generally step up. So I am very lucky. I think that's not 100% of the time, but I think in general, we relatively recently, within the last year, had a situation where a colleague's parent passed away unexpectedly. And you better believe everyone's lighting up like, I'll help, I'll do the shift, I'll do this call. Oh my gosh, can I help? It was like we get to figure out who amongst all of us that wanted to help. It was a good problem to have. And I
Yes.
feel like in general, that has been sort of the way it's been with our practice. So I think I'm very lucky in that way. I think occasionally with staff and other folks within the practice, occasionally that's been an issue in the past. But honestly, we've got, again, I feel like I'm jinxing all of us right now. We have a really good sort of team in place across the board right now. Everyone's getting along, everyone's working well together. There doesn't seem to be a lot of drama. This is fabulous. Let's keep it that way. But it's been really good. So
And so
I'm lucky.
who does the hiring? Do you do the hiring or and I know
Yeah, so there are 5 partners. And I think it depends who we're hiring. So for doctors, for physicians, it's the partners. We interview, certainly our practice manager is often in as part of that as well, but it's the doctors for the doctors. We have a really great nurse manager who we love very much. And in terms of nurse hiring, it's typically her with the practice manager, and usually one of the partners. Typically we have one partner who takes a little bit of a managing partner lead in terms of admin kind of stuff. So she will often weigh in with that stuff as well. And then office staff, we have the office manager typically manages that. So it depends who we're hiring.
is there a question that you like to ask when you're interviewing other fellow pediatricians? Is there some particular question or just kind of how it just flows during the interview?
I'm more of a flow person. I feel like that's why we try not to overwhelm people and have all 5 of us go to an interview lunch, because that feels like that's not going to be a good vibe for folks, but 2 or 3 of us. And I feel like there's a couple of my colleagues that tend to have set questions or questions in their minds that they want answers to. And I'm more about having a conversation, listening to the person talk, and then vibing off of whatever they're saying, I think is more my style. But that's why there's usually at least 2 of us, because we all have slightly different styles. So we end up getting some solid information along with just personality vibe checks. Because I think you want the person to be qualified, you want them to have good recommendations, you want to feel like, they know what they're doing, but you also want to feel like they're going to fit into the culture of the practice. So I think that's really important too.
Now, what are the hours in your practice?
So that has changed quite a bit over the course of pandemic life. So currently, we are 7 a.m. to 5 p.m. Monday through Friday. And then we see patients in our bigger South Riding office on Saturday mornings only, like 8 to 12, and no checkups on Saturdays. So it's sick visits and then newborns. The exception to that is newborns if they need to come in. And then we're closed Saturday afternoons and Sundays. When I joined the practice, part of the reason they were hiring is because we used to have evening hours where there was enough of us that we worked in shifts. So there was like every day, there was one 7 a.m. to 3 p.m. person, a couple of 8:30 to 5 people, and then one, and sometimes 2. It changed, the hours of it changed a little bit over time, but it was like noon to 8 or something, like a later shift to do evening appointments. And parents really loved it. It was a little stressful because you're there by yourself trying to figure out like well checks and sick visits. Each had like a nurse triage kind of person with us too. And then the pandemic hit, and all of a sudden, a lot of the need for large numbers of appointments and evening appointments went down. And so we scaled back our hours there were several iterations of this, some version of 8:30 to 5. We always kept Saturday mornings. And then in the last, it's got to be at least 2 years, we started opening back up at 7. And essentially, I'm sure evening hours would be very popular with everyone except the physicians. And so we have not, it keeps coming as a conversation, but it hasn't happened yet. I think part of it is right now, we are still in our practice, at least somewhat trying to split up well kids from sick kids.